Done. So hey guys, what's up? Hope every one of you are doing great. So we are back. So we have our your favorite guy. Okay, हमारा तुषार bro. So he's our invitee for today. Invitee ना bro?
Yes.
So he's our guest. But what is invitee? मतलब those who are invited. So today we have our guest, special guest. Okay, and the topic today definitely will be related to mental health because he is someone who has like a good understanding of what mental health really is, and he has been doing internships and studying psychology like for a brief time. So definitely he will be imparting his experience and knowledge to all of us. Okay, और उसके साथ साथ that definitely it will be interesting for you also, all those aspiring psychologists and those who are interested in mental health. Definitely this will help you. Okay, so today basically we are discussing about like what actually is client information form. Okay, what do psychologists do? Okay, when you visit a clinic or any psychiatric division, like what are the things that happens. Okay, we'll try to give you a basic understanding. Okay, so let us start. Okay, first of all, like sir, I would like to ask sir. Okay, so sir have been seeing clients. Okay, those dealing with mental health problem, mental health illness. So when a client comes, sir, so what is the first initial step? What do you do with the client? And because mental health is something different. Okay, there's a taboo whenever a person comes. He's with certain kind of stigma because it's not like a you are going to some hospitals for any other kind of treatment. You are going there for the treatment of your mental health problems. So definitely before coming to all these things or before coming to clinic, you have a set of mindset. Okay, and sometimes you're not really cooperative. So let us find out ना what is really happening, what happens. Okay, बीच बीच में इंग्लिश थोड़ा बिगड़ भी जाए तो दिक्कत मत लेना bro. So let us go to तुषार sir. Okay, I'll also be little bit contributing जो मुझे याद आता है, but we will definitely be discussing about mostly client information form. ठीक है sir? So let us start sir. Like whenever a client approaches you, what's the first step?
First of all, it depends. First of all, we notice how the client is coming in the clinic or something. First of all, we notice how their appearance is. We have to see.
Like you really have to be observant because psychology is such a subject. You have to be highly observant. Here, what is the dilemma is like client will not tell you everything. What I personally believe, no one will share your darkest fantasies, darkest problem, whatever problem he is having. Nobody would like to share because it's something related to like his self, okay, or his surroundings. So थोड़ा difficult होता है, especially in case of mental health problem. So observation is the first thing for any like intern, psychologist, therapist. So yeah sir, first thing is like
First
you
of
observe.
all, see, the observation starts from the moment the client comes in.
Yeah.
The way they walk in, the way they open the door, the way they sit. It tells a lot about their personality.
Yeah.
Okay, the second it comes
Like if you can sir like थोड़ा brief में you can tell like
explain.
yeah what you really observe and what are some things like that indicates कि हाँ this means this थोड़ा psychology में like what do you really observe about things.
Okay, let's consider for example if a patient is coming and sitting and he wants to sit against the wall. That means he
Okay.
is paranoid. He is
Yeah.
paranoid that somebody might attack him or
And-
like somebody standing behind him. That is why he is sitting against the wall.
Yeah, and many of our clients, many of our not client, many of our staff would not know what paranoia is. There are a lot of illness, okay, and paranoia is one of the mental illnesses. And sir, I think it's one of the symptoms also. So sir will tell us thoda bahut about paranoia. And what is that, sir?
Paranoia is basically when you're scared of somebody doing something to you. You know, when you're just scared of random substance, you're constantly scared that somebody might hurt you.
You are always in a state of suspicious that something or someone is against you. There's always constant threat, like हो रहा है.
Constant in your head.
And you can just imagine what the person may be feeling and what is going in his mind when there's a lot of like always you are in a state of threat.
Yeah.
So you can basically understand that. So then what happens? Like what's the next step? Like after observation, like if the clients come and he meets you, like then what was the process?
After observing how the client came in, how the client is sitting, we observe their appearance, how they are dressed up. First of all, are they hygienic? Are they well groomed? Is there any difficulty in their motor movements? Are they, the way they're sitting? That tells us about how confident they are, whether they were willing to share something, whether they are willing to take the help or not. That describes a lot about them.
And what about savvy appearance and things like that? Like if person is coming savvy, like what does that mean? Ki, like the person something like
Let's consider for example somebody has OCD. So
Okay.
before sitting, he would check everything. He would check the chair, does it is sitting in. He would check that there anything is there anything on the chair or not. He'll take care of everything. If the person is a shabby place, he can tell that he's not doing himself. Maybe he's just going through something. Maybe he's just normally there. For somebody
Yeah.
who doesn't know about mental health, they would consider he's just not ready yet. He's not,
Yeah.
not doing.
He's not like
He's like
many
okay.
people will assume. Many
that
people
he's
will
okay.
assume that it's okay because sometimes you don't really
Yeah.
take showers because it's rainy day or something like
but,
that.
But for them, it's not.
They have not been like taking shower because lot of things is going on. And what I think, sometimes the savvy appearance definitely indicates toward depression, schizo, or some things like that. No, sir?
It depends. It depends on the case. We cannot, we
Yeah.
cannot like make it that they're schizoid or
We cannot directly level them or directly say that, but there are possibility because if you are savvy, okay, any individual that like you, like me, any other person would like to take care of himself. And if you're not taking care of yourself, definitely things are not going as expected.
Let's take for example, if you go to psychoanalysis.
Okay.
In the psychodevelopment stage, there is a second stage called anal. Freud said that if your person is unhygienic, it is because of fixation to anal state, if he is unhygienic. So
Yeah.
that roots the problems once they arise.
It's all like, yeah, sir, yeah.
So after periods, we start talking to them. We like, as a psychologist, as a counselor, as a coach, we build rapport. We try to conversate with them. We like ask basic questions. We ask the case history. What's your name? What's your family like? Is there any illnesses in the family? Or what are the problems they're going? We list the major symptoms. Then we like also like ask them several questions regarding how long have the symptoms been there.
Like what are the symptoms? And I've already like mentioned in my some videos that the first and the very basic thing about like counseling is rapport building. Okay.
Yes.
If the rapport is not built, then definitely you will be having problem to find out the underlying factors because the client is not willing to tell you anything. Even if he tells you something, you are not sure that he is telling it correctly.
Counseling is based on trust. If the client cannot trust you, he won't share his information with you. He'll always be hesitant. You have to make it comfortable enough for them, so he'll be able to share you like with you his inner thoughts. What
And that makes psychology a little more complicated.
it is really complicated because it is very difficult to create this positive environment in a client.
You have to create that environment where you feel comfortable, where you have trust on yourself, and he is willing to share all those problems.
And
Okay.
it takes time.
Definitely, that is why all those treatment plans, all those sessions, we commonly hear, in general problems, like if you're having fever and things like that, or even if you're having other problems, you go, you take medicines, okay? You just go and tell your problems to the doctor and he will prescribe you some medicine. But in case of counseling, it's totally different. First, you have to build rapport, and the session may go as long. It all depends on how much willing is the client.
From one session to like any amount of sessions.
Yeah, that's.
And also, you cannot help someone who is not willing to take it. If he's like not willing to recognize that he has this thing, you cannot help him.
I always say, whenever I try to make videos, I always say like first thing is awareness. You need to be aware like what are really problems. Am I facing some problem? Is it impacting all different areas of my life? That's the first thing I tell all about, like whenever I try to make some video, I tell awareness is the first thing. Second is you must be willing to take help. Okay?
That is the whole concept.
That's the
if you're not willing to take help, you cannot. Nobody can help you.
Nobody can help you. Yeah, that's the main thing. And if you're really not willing to help yourself, then you can just imagine like the life gonna be tough. Okay? And I've always mentioned there is help available. There are counselors, there are psychologists, there are therapists. Okay? So that was it. Okay? At the same time, so like what happened next? Like after you bring that rapport, what else? Like how do you diagnose the problems or whatever problem he has? Like what are the things?
We talk about appearance and analysis, then we go to the flow of thoughts.
Okay.
We recognize how they're talking. Are they able to, is it abstract thinking? Do they
Yeah.
have any difficulty in socially, adjusting with people? Do they have problem with like their memory? Whether they immediately recall what they're supposed to do. We ask them general question, what did they think about what they did in the morning, what did they eat in the morning. To ask them immediately to check whether their memory is good or not. We take certain things, we take memory, we take intelligence.
All these things come under MSc, mental status examination. And I will just give a brief that it's all about what going into cognitions, at the same time like your thought pattern, your memories, okay, your judgment skills. Are you able to comprehend what is being said? Okay, because lot of time, lot of problem, as ma'am has also mentioned, lot of problems are there. where people is not able to comprehend what is being said. They are in their own world. Okay, these are some different type of mental illness that we will be discussing, but we will be mostly going to like those normal cases of like negative self-talk, overthinking, okay, some depression and things like that, where people come with their problem. And what's the next step then? If I'm coming with a problem,
Yeah, very one thing.
yeah,
MSc is completely based on observation.
Okay.
It starts from the moment the client steps in the clinic or inside the cabin. It starts from there, and it stays. You have to be completely observant. You have to be very observant when the client is sitting in front of you. You have to observe the little movements. You have to like observe their hand movements to the moment they're looking at the room. You have to observe everything. For the next 45 minutes when the client is with you, you have to observe everything what is happening with you.
and ma'am also mentioned that it's all MS is all about 95% of
No,
the
it's
observation.
100% observation. It's completely observation.
Complete just observation and observation. So as a student, as an intern, as like a future mental health professional, you have to be highly observant,
Very
and that's the first skill we all interns are taught. Okay.
observant not
Yeah.
in the way they talk, observant in their body language. Because there are some things which the body says, but we cannot take it out from our mouth.
No.
There's a lot of things which are then unconscious, but we cannot bring it in like our conscious mind.
Yeah.
And that is when the body language hits.
That's helpful.
After doing the MSc thing, MSc like continues to like to whatever amount. Then we start taking the cases.
Okay.
Take and like the information the client gives us.
Okay.
So based on MSc and the case history, we can identify what they have. For example, and what is the birth cry?
Yeah.
The moment the person is born, we have to ask like, whether the birth cry was normal or delayed, whether the pregnancy was normal or delayed, or like it was early, because that is the major cause of something going on.
What I can get out of this is like as the client come, okay, we have to take the whole history right from his birth and even before birth
Yeah, prenatal
till
history.
to like this age. Okay,
Yeah.
what has been happening in his life? That's the most important thing, because somewhere or the other something has been wrong, or there has been underlying factor that has happened in his life that has caused this problem, whether it's social anxiety, whether it's depression, whatever it is. Okay, it definitely genetic factors matter.
There are a lot of factors. There can be genetic, environmental,
Yeah.
social, psychological, physiological. But there can be any.
There can be anything, and the main thing that I could also remember is we need to go deep down, right from prenatal, as Sir mentioned, no? Like what happened before birth, like how the mother used to treat, okay, and how mother used to take care of herself. If mother was like taking some or the other kind of medications or drugs, or she was into the state of depression herself, we take all this family history, okay. At the same time, as some mentioned, birth cry after the individual is birth, or even during pregnancy, we check like whether the pregnancy was normal, whether it's cesarean, and there are other exceptions too. And after that, the individual is born, then definitely birth cry. At the same time, there are other things that need to be mentioned.
After that, we need to check the milestone.
Yeah.
Developmental milestone.
That's the main thing, okay.
Whether they were able to talk, they were able to walk in the normal duration or not. So that is very important.
And all these things help you figure out like all those neurodevelopmental problem. Definitely I have discussed a little bit of neurodevelopmental in my previous video too. But in order to figure this neurodevelopment problem, you can just figure this prenatal, postnatal and the pregnancy period. And you will be aware. And at the same time, the child developmental period. And if the milestone is somehow delayed, definitely the problem arises. And a lot of neurodevelopmental problems like autism, Down syndrome, ADHD, they can be actually find out with these things only. If you ask the client's parents, okay, about all those things, even the client is aware of those things. Okay, in case of neurodevelopmental, definitely the parents' information or the parents need to be like more assertive and and they will tell you all about that thing. So
it's not about taking the consent of the client; it's about taking the consent from the family as well. Because
family play an important role.
Client can lie. So we need to consult that with someone.
Yeah, that's the very important thing, because if a client comes with whatever problem, okay, he's saying his own story, but you cannot totally depend on that story. You have to also listen to the.
We have to confirm it whether it has happened or not.
Otherwise, the problem will remain like undiagnosed. At the same time, the problem may not be the actual problem that he's saying. So that's the thing, okay. So what next, sir? After like milestone, like what else?
We just go through we ask the milestone, we ask like how long the symptoms have been there, how are those symptoms causing them inconvenience.
Like if we discuss a problem, let us discuss a problem. A very, very basic problem. In individual, someone having problem with social anxiety. Okay.
Social
So,
anxiety. Okay.
Like he comes with all those problems
If
and
somebody has a social anxious, I pretty much say he's introverted. Because
yeah.
he is unable to share his problem with other people.
But sir, I'm not just contradicting you, but what I believe is like introvertness is a personality type. But isn't social anxiety a real problem mentioned in
Social
DSM also?
Social anxiety is sort of.
Yeah.
It's a part of anxiety itself.
Okay.
So like, and I'll tell you one thing. Socially anxious people are someone who are unable to trust anyone around the surroundings. It's more like they have difficulty in the social background as well as like they have very much difficulty in adjusting the social environment near them. Whether it can be just talking to them.
Like what really happens? What do you think that what happens like whenever a person like with social anxiety, like what might be going, like what are the characteristics, like why doesn't he like why he become anxious when people are around? Because we humans basically are social animals. Okay, we have been living together in the communities for a long period of time. But socially anxiety is something that is, I think, I don't know whether it used to be there in the past time, but it had come with time. Okay? So what was the problem? Like what goes in, if you can tell
I'd
something?
say pretty much it's a like problem of this own self. How do I put it? Let's say for example, they are embarrassed or they're anxious about what the other person might judge or think of them if they say do something.
Like there's somewhere or the other there's a cognitive bias within self.
Within self. I'm telling you, it's mostly related to self. For example, if there's I'm a person, socially anxious person, I just came sitting next to me. Even if you just say hi to me, it will make me feel anxious. I will give they will thought going on, why is this person talking to me? What does he want from me? Should I reply to them or not? And these small thoughts gather up and make them feel anxious.
Yeah. And
anxiety is mostly related to your future events. And you just keep on thinking that why the person was trying to hit on conversation.
That's a very problematic. Like if you are into that shoes, like if you really sometimes you just think those with social anxiety, like what are they going through? Because whenever they be around people, their anxiety occurs. Or the alarm system, anxiety, what I believe, what I've read, it's an alarm system, okay? When you start fearing things like there's certain threat around you and you want to avoid that. And just for a moment just think what happens to those with social anxiety, okay? Because
people think it's a very small, it's not a small thing. It's a very huge thing. It's,
even
people with socially anxious people are difficult, they cannot perform well in jobs.
Yeah.
Because they cannot adjust with social, like
definitely.
It's very difficult for them to go outside of their own house. It's difficult for them trusting new people.
Because that creates
and that actually makes them less exposed, gives them less exposure to the surroundings, to the outer world.
Yeah, they could have done very much. Okay, just for an example, like
for example, we are social animals. We need other people with us. We cannot just survive on our own. We can say that we can survive on our own, but we cannot. We cannot survive on our own. We need people to help us. But socially anxious people have it difficult because they are unable to be with other people.
Be with other people, and that's a very problematic scenario. Like you can just imagine, like those with social anxiety, like they really want to be around people, but it's not that they are aloof or anti-social. Okay,
it's
just that
they cannot from the within.
Because whenever they see people around, the trigger, like the brain start.
The fear kicks in.
What is that? What is that term?
Embarrassment.
And the anxiety thing, the anxiousness, and all kicks in automatically. Okay, and that makes the situation more problematic. So they rather try to stay in their own comfort zone.
And that actually, you can see the physical symptoms. Sometimes people start sweating out. People start
sweating out. To mention, like, if sir would like, please sir tell us something about what anxiety. Just what are the symptoms, like what you have seen around people, like basic anxiety. Social anxiety definitely term means ki you when you are around people definitely you get anxiety. But what really happens in anxiety, sir?
They are not set symptoms. There can be a lot of symptoms. For example, like just say anxious.
Okay.
Maybe when they're anxious, they start clenching their fists. Maybe they start sweating. Maybe they there will be a lot of finger movement. They will be trembling, but they would like to show it. Maybe they're just moving their feet, small voice. It can be anything. It can be from certain things to like anything going on inside their head. Maybe sometimes people start sweating all over the body when they are anxious.
But what I believe, sir, like anxiety is common to every one of us. That's the first thing. Okay, like you can be anxious anytime. Okay, even when I go in the stage for a public speak or even for debate, okay, definitely the anxiety kicks in, but with time it gets normal. But in case of social anxiety, sir, what's the case? Like I think the situation exaggerates more.
It's a disorder problem. It arises. See, it takes time from it turning into anxiety to social anxiety. Social anxiety is a proper anxiety disorder. Okay, there are socially anxious people, but for it to become a disorder, see, for something to become a disorder is basically it disrupts your social, personal, and your life and your work life. It disrupts all of it. That is when it becomes a disorder.
Yeah, I've already also told sometime. I've also told sometime to my prescriber that anxiety, and when it becomes a disorder, like anxiety is a normal phenomena, okay?
It is. Everybody is anxious. Everybody has fear of safety. Everybody has fear of future event. Everybody has fear that somebody might harm them, but to an extent. But when it disrupts your personal, your work life, and your family life, your social life, then is when it becomes a problem.
When it starts impairing your whole areas of life. No? At the same time, there's duration, okay? Like in order to be, for mentioning that in order to be diagnosed as some mental illness, there has to be certain duration.
There are certain criteria. There are definitely written criteria in DSM. If people not everyone goes through it, but there are definite criteria. And a person fulfills that criteria, only then we can diagnose them with that disorder. Not otherwise.
And sir, what are the possible treatments for these things?
CBT. CBT helps. Any behavioral therapy would help with